you everyone for having me here, and thanks StartUpHealth for hosting this. It's great to see a lot of familiar names and faces as well. So I'm here to update all of you about Valera Health and what we've been doing since we've started the company about 5 years ago. So the first few years, we developed a platform with an app and a provider dashboard to provide mental health services for others. And then we launched a telemental health service last year in the middle of COVID, and we've seen tremendous growth and traction. So what we offer is a telemental health service to high acuity patients, particularly patients with schizophrenia, bipolar disorder, and major depression that requires multiple medications. The SMI population, not all of you may know that it's 6% of the general population. And it really represents a really high cost segment of health plans. It represents almost 44% of health plan dollars, and they have higher hospitalization rates and ER visits. And right now, I think everyone has seen the impact of COVID. It's, suicide rates have gone up through the roof, substance abuse, overdoses through the roof. And we've seen a lot of companies, a lot of investment dollars going into the industry, but many of those companies are really catering to a direct-to-consumer mild, depression, mild anxiety. What we've created is really a full-on comprehensive model that's layered with a digital technology that we've validated the earlier years with other health systems. So we have a case manager, psychiatrist, and a therapy team. The case managers use a data-driven approach for case management, and we do symptom monitoring. So we do much more than the PHQ-9 and G87s for anxiety. We also look at symptoms of schizophrenia and bipolar disorder, and then we use that in a kind of like a risk stratification methodology. And we also do case management huddles with the health plans, offering really this collaboration between the health plan internal case managers as well as our case managers, so we can identify those in need the most. Other differentiators is this focus on outcomes, and we also see adolescents with severe illnesses as well. Our connection with PCPs, we've been able to get 1,000 PCPs to partner with us over the last 12 months, along with an HEDIS improvement program, particularly some of the HEDIS measures that health plans face right now with particularly Medicaid. So we've been able to collaborate with some of the largest organizations, some of the names that you've seen around City Block, Village MD, Health First, CDPHP, both regional plans as well as national PCP companies. And in just 12 months, we've been able to contract with national health plans that cover 12 million lives, as well as large provider networks across 2 states, New York and Arizona. In a snapshot, you can see that we've been really busy. We've seen 18,000 visits covering 12 million lives. We created a provider network of 170 folks. Many of them actually work for us full-time. They're W-2 employees with full benefits. They're not just, this is not an Uber model where we're contracting with 1 or 2 hours. And then our HEDIS scores, we just knocked it out of the park. The industry standards for HEDIS 7, HEDIS 30, 28% for health plans. We had 80% for 2020 and rehospitalization rates of 1%. Our proprietary technology that we've built with our own team and our content that we've developed augments these services. And of course, the depression improvement remission rates are extremely important for us as well as to our health plan clients. Our no-show rates, 8% versus 28%, and our net promoter score is 75 versus 30. This is to show the durability of our treatment plan and our adherence. So we took and we analyzed our cohorts from last July, August, and September. And over 40 weeks, we've shown that 60% of our SMI population patients are coming to us week after week after week, compared to our non-SMI population, which is 40%. Now, if you ever, if you had a chance to look at the SPAC information from Talkspace, their drop-off rate is 3 months. Our revenues, we launched our telemental health service in 2020. We're going to be bringing in $9 million in 2021, and we're going to quadruple that in 2022 based on our 30% growth. Our team are experienced operators in both the clinical side as well as on the operational side. And we also provide multilingual, multi-ethnic providers, as well as a focus on LGBT communities. We're raising 20+ million, and we're speaking to many folks, but I'd love to talk to more. And thank you.
Awesome. Thank you so much, Thomas. I know you didn't mention this in the chat, but you are one of our sort of longer term health transformers, been with us for about 5 years. So great to see the progress. With that being said, curious what your growth trajectory is. There we go.
So we're going to go into 10 more markets, geographies over the next 2 years with the capital that we raise, and we're going to be rounding out the team with senior leadership, as well as hiring boots on the ground.
Amazing. Other mental health companies, services, the mild consumer market, why'd you choose the SMI?
It was a no-brainer. Number one, I think the people who needed the most their needs were not being met by the marketplace. That's one. Number two, I think most of my experience as a clinician and most of the work that I've done over the last 25 years in the FQHC world and minority communities have always been with high need individuals, complex cases. At the same time, the health plans need the most care, need the most help.
Awesome. So some questions coming in the chat. What has been the most difficult part of obtaining customers and then bringing them on board?
I would say the most difficult piece would be the credentialing aspect of the providers. You know, it's much more of a process, systematic issue. Each health plan have a different credentialing process. Sometimes it takes 3 months, sometimes it takes 6 months, sometimes it takes 4 months. So that's one. Number two is many of our patients have lower tech literacy levels than the normal mainstream population, and so we have to balance out that high touch ability to kind of help individuals ramp up through multi-channel approaches, video, calls, chats.
Awesome. And last question, what's your big differentiator?
All the things that I've talked about. One, we see the SMI population, over 30% of our patients are SMI. Two, we speak 10 languages. Three, we're focused on outcomes. We have all this data about depression remission, depression improvement, as well as data monitoring our SMI population.